Hi, it's Karen, and welcome to a virtual dissection of the shoulder filament. Here we have the virtual cadaver in the posterior aspect, and then laterally, that view of the deltoids we can see moving around to the anterior aspect, further around to show where that is. And I'll zoom out so we can get some context and see the pectoralis region, and we'll go ahead and remove and dissect away the superficial structures. We just moved the deltoids out of the way so we can see some of these deeper structures. Let's focus in on what's happening in the shoulder girdle by moving through some of these muscles. The short head of biceps brachii and then the long head of biceps brachii. We're going to move both of those out of the way. But it's really handy here that the system has left in situ this intertubercular tendon sheath of the biceps tendon. So when we move through and remove that layer of connective tissue, we'll start to see there is a groove there, that bicipital groove, a landmark in the humerus. Now coming on to identify the bony structures of the shoulder filament. This is really important for understanding the spiral motion, the rotational action of the shoulder. And in these virtual dissections, I'm not focusing on the movement. We have a window of time here just to get in an overview of the anatomy of the region so that we have a shared language to talk about the movement as we go deeper. Okay, humerus, the long bone in the arm, which you're no doubt familiar with, and we can see that bicipital groove there. So when you look at a humerus, you can get your bearings and understand how it might fit together with the scapula. So that would be the next area of interest, which is lying deep to the muscular tissue that surrounds it. So scapula is there. I'm going to hide the others so that we can take a look at the scapula and identify some areas of interest. Here is the acromion process. This whole area, the outcropping here, and you can actually palpate it in your shoulder. You might be able to get a feel for that bony landmark in your shoulder. That bony landmark there, the acromion process, is continuous with the spine of the scapula. You don't just have one spine. It's not just the one vertebral column in your back. No, you have a few different spines in your body. And this is the spine of the scapula. And it will be an important landmark for us when we start looking at the rotator cuff muscles. Okay, so here we also have the medial border of the scapula. We have an inferior angle of scapula and a superior angle of the scapula. Above the spine of the scapula would be considered superior. So this is the superior aspect of the shoulder blade, your scapula. And what I really want to bring your attention to here is this space. It's like a chute that you could imagine just threading a finger through or gliding the pencil through that space. Or if you're really adventurous, you could make yourself super small and slide down that chute. You can see it's just like a flume at a certain angle. Anyway, finding and identifying that space will be important for us. And we can see there's a very propeller-like action to the scapula that those bony outcroppings all have names. Acromion process, coracoid process over here on this side. And then this little dish, which looks like a saucer, a teacup and saucer, or a golf ball might fit on the top, like a tee, a golf ball and a tee. And that very shallow area is a fossa, big glenohumeral fossa. And really important to see that. And when we add some connective tissue on. It'll take a few clicks, but hopefully it'll get us there. Maybe if I show others. And There it is. So comparing that golf ball tee, very shallow depression called a fossa, which looks like a saucer for a teacup, it's only when you add the connective tissue elements around it, the fibrous layer of the articular capsule of the glenohumeral joint, right? The synovial joint elements, like a headdress. Oh, that's when you can see the socket. But none of the socket is bony. This is a thing to keep in mind when we talk about the shoulder, and it's having evolved for mobility rather than stability. It is very much a movable feast, the shoulder. So let's remove some of these structures. We'll hide the biceps and then have a look inside the shoulder filament. It's a very beautiful way to take a look at the architecture here. Main goals for this video are to get acquainted with the anatomy of the shoulder girdle in its bony structure, and also to take a look at the rotator cuff to see the common insertion inside this synovial joint capsule so that you understand and we can talk about the movement that has evolved inside this joint system. Okay, so let's see if we can recognize these structures now. This is all connective tissue holding the head of the humerus in place. Here again is the glenoid fossa. That's the articular cartilage that covers it's the lining. And then in here, this ring is the labrum, the glenoid labrum, which can get irritated. And that forms the ring of stability around the glenoid fossa because it's fibrous, like the meniscus. Anyone out there who's had a meniscus tear or labrum irritation, it's poorly served with blood supply. And so can be reluctant to heal. So we have the cartilage lining of the glenoid fossa. Then we have the ring of fibrocartilage, which is the labrum. And then here we have the synovial membrane. This synovial membrane is a smart material indeed. All of it is very intelligent. But in particular, the synovial membrane of the articular capsule, it will secrete synovial fluid so that these structures retain a rolling, gliding kind of movement in there. The head of the humerus glides inside that pouch. None of it bony. All of it cartilaginous connective tissue, different densities here, different levels of tendon concentration. And as you can see, there's those striations, other aspects of connective tissue that contribute to the rotator cuff tendon, the tendinous anchoring points for the muscles of the rotator cuff. Okay, so let's zoom out. As we zoom out, we'll come around. Now, we've already looked at the scapula in some depth, and we can recognize here the acromion process of the scapula, hopefully. And remember the spine of the scapula just there, the medial border of the scapula. So we have the scapula in the pocket now, hopefully, feeling confident with scapula. Now what we need to recognize are the muscles. The three out of four rotator cuff muscles that live on the dorsal surface, the posterior aspect of the scapula. So those will be superficial to the scapula itself. They're on the outside towards the skin. And so supraspinatus is living there in that chute that we talked about, that gliding space. So you can see supraspinatus, infraspinatus, because it's inferior to the spine of the scapula, supra, infra, spinatus, and teres minor. Now we've got those three muscles of the rotator cuff, confident with those. Let's move around and have a look at the arrangement here of rotator cuff muscles. There were those three that were superficial, to the scapula itself, which is there in the middle of that kind of muscle pocket. Now we have a fourth muscle of rotator cuff that lives there in between scapula and the posterior thoracic wall. So that one's can be hard to see. Subscapularis, also named for its position relative to the scapula. It's underneath the scapula. Okay. These tendinous insertions of all four of those muscles, they will connect as the rotator cuff tendon, which will be continuous with the rest of the elements of the joint, the synovial joint. Very much mobile, movable, and very sensitive to mechanical forces. Not neat and tidy as it would look like here. They don't just end. That is an artifact of dissection. Someone's come along with their scalpel, their digital scalpel, and has cut those muscles out of the connective tissue continuity. So taking everything we see with that grain of salt and with that piece of understanding that all of this is continuous. But it makes it easier for us to learn when we can categorize, cut it up into neat pieces and see what's happening. So we have looked at humerus, and then we faded the humerus. Then we looked at the scapula, our shoulder blade. And now the third bone of the shoulder filament will be the clavicle. So I'll need to pop that one back on, and I'll do so now. Clavicle, and a big one is the connection there between the clavicle and the acromion process, the acromioclavicular joint, the AC joint. And you can see here there is a synovial joint, acromioclavicular or AC joint, that little synovium. But that joint doesn't have the deep dish benefits that you get in the glenohumeral joint or the hip socket. You don't have that depth of coherence, that joint coherence where there is a ball. You have the concave and the convex, where the one bone can sit inside the nurturing space of another bone and all of its itinerant fascia. You don't really have that here. So that joint is vulnerable, the AC joint. If you've heard of a shoulder separation, that is the site of a shoulder separation where acromion process normally ends up a good centimeter or two underneath where it should be. And it looks like it's a telltale sign, the piano key, that step, which indicates a shoulder separation. Moving medially, the clavicle will connect. Collarbone connects into the sternum, the sternoclavicular joint. Another very vulnerable mobile joint, all of it rotational. When we come into shoulder flexion and shoulder extension, the clavicle spins. But I have to keep myself on track here. We're not talking so much about movement in this video. It is simply a lay of the land in terms of anatomical nomenclature so that we are comfortable talking about the three-dimensional in space, and then we'll move on to the multidimensional as we get more confident with our language. Rotator cuff muscles, very important one now we're going to hone in now that we have all three of our bony members introduced and discussed in, at least at the basic level. We have our clavicle, scapula, and humerus. We have our joint capsule and the articular cartilage all around. We have been acquainted with our four muscles of the rotator cuff, the superficial three, and then the deep sub is there. Okay, now the space, to reinforce the importance of this space. So the main player, which is most often vulnerable to our movement, would be the supraspinatus. That is the one, because this little guy is in harm's way when we flex the shoulders indiscriminately, just whack the arms up, or in a case of trauma, the head of the humerus will bash the acromion process. So the roof of the acromion here and the head of the humerus, like a mortar and pestle, those surfaces are very unforgiving when they are not curated, when that movement isn't gliding and very rotational in nature, we end up with movement that starts to impinge, aggravate, irritate, otherwise annoy this muscle and the connective tissue there. All of this, the structure here, supraspinatus especially, and the articular cartilage, coracohumeral, I believe, and this joint capsule, all of that is very vulnerable, and especially the supraspinatus. So bringing our attention to the 3 bones of the shoulder girdle. A little quiz for you, if you can get them all down on your paper or pop them in the comments. 3 bones of the shoulder girdle, the shoulder filament, and the 4 muscles of the rotator cuff. You could write those down as well, and how those fit together. And then looking also at the deep dish of the synovial joint around that glenohumeral joint and how it reinforces a very shallow glenohumeral fossa. It's just like a teacup. And all of those structures of the shoulder, very vulnerable to movement. They have evolved for mobility, not so much for stability. And it is our job as movement educators to understand that arrangement and curate movement in harmony with these structures. Thank you so much for listening.